You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Yeah, I'm Ivan Zach, and I'm excited to be back to awesome rank. For some reason, I wasn't for a couple of shows, so but I'm more excited about talking today to a colleague of mine, Dr. Kate Boatright. Dr. Kate Boatright has been in small animal practice since graduating from University of Pennsylvania in 2013. After nearly 8 years of full-time practice in both general practice and emergency clinics, she moved to part-time clinical work to pursue her passion of educating veterinary professionals as a freelance speaker and an author. Dr. Boatright enjoys discussing mentorship, the unique challenges facing recent graduates, wellness, and spectrum of care. She believes deeply in the role of organized veterinary medicine and holds leadership positions in the AVMA and her local and state veterinary medical associations. In her remaining time, she stays busy chasing her toddler, running, reading, and watching movies with her husband and cats. Kate, welcome to the show. Thank you for finding the time.
Yeah, thank you. It's great to be here.
Well, I'm glad to see that your husband is one step up above the cats. One of the guests
Some days.
ranked the husband on the after kids, dog, and cat, I think. So this is good. So among those passions that you have and the topics of veterinary medicine, we wanted to talk today about the spectrum of care. And before we dive into it, what is spectrum of care?
Yeah, so, spectrum of care, it's a new term for an old concept. So the term has been around, I think, since like 2018. But essentially, it's the approach to practice where we're presenting a continuum of options for owners instead of just thinking about that single set baseline that we have to exceed. We have on one end gold standard care, top line, most invasive, and on the other end, we have, depending on the condition, palliative care or symptomatic treatment, economic euthanasia, the less invasive, less extensive treatment. And the idea is that that not one end is better than the other, but that instead we've got to find what fits for the client and the pet based on their own goals, which can be financial limitations, but it can also be personal goals, physical limitations, their ability to medicate the pet. So as I said, I hear some people who say, well, this is how we've always practiced medicine. Why do we need a fancy word for it? And I think it comes down to just the way veterinary education has changed, and that a lot of our students aren't learning this way of practice. And so to keep that in the forefront of our minds when we're teaching the future generation of vets.
So you're talking about the spectrum of care being an important component of the well-being and mental health of the veterinarians. What angle do you take on this, and how does spectrum of care and definition of it influence the mental health for the veterinarians?
Yeah, so I think the biggest group that it influences is our early career veterinarians, who we know from the research are are most at risk for mental wellness troubles, psychological distress. And they come out of school and they've spent 4 years being exposed to a gold standard ivory tower, having limited exposure to offering options, the real world of the client who comes in and says, I have $100 and this is, what can we do today? And so talking about spectrum of care, normalizing that type of practice and giving them the tools to have conversations with clients, build relationships, and offer a variety of options allows them to avoid those situations of moral distress where, they feel like, hey, I've got a parvo case and I really want to hospitalize it, but the owner can't afford it. We've got the CSU outpatient protocol now. So there are other options. It just may not always be things that they're comfortable with from their training.
So, Kate, it's absolutely fascinating. The last episode that we recorded, we had Amy St. Arnaud on the podcast, and we were really talking about access to care. And so this idea of a spectrum of care and access to care seem really connected. And so, in the last episode, we talked about the efforts that she's done at her two clinics to, through various different means, kind of, I guess, open the spectrum of care for any of the people that come through her door. And so it seems absolutely applicable that, burnout and all of the other issues that are plaguing the industry will absolutely occur when the spectrum of care for a particular client is very, very limited. And so I think the work that Amy is doing is fascinating when we look at the work that you're doing around helping educate this spectrum of care, because I think the work that Amy's done with her two clinics really open up the spectrum of care. Does that make any sense?
Yeah, absolutely. And Amy and I are actually recently connected.
No way.
Yeah, and they have a nonprofit, the Open Door Veterinary Collective, and they're working on a certification program to improve access to care for clinics. And I'm actually teaching the Spectrum of Care module for that certification.
Makes sense.
Yeah, I love the work that she's doing, and absolutely, spectrum of care is, definitely a part of that access to care conversation. For us as veterinarians, it's a complex issue, and this is, one piece of the puzzle to improve that.
Complex, I think, but it also seems to be kind of, when you step back from it after, 1.5 conversations on the podcast, it seems like common sense. But common sense is not always common, right? It's, if you don't know, it's like we don't know what we don't know. But it seems like this educational piece and then this facilitation of like access to care through various different methods could be something that really revolutionizes a lot of the problems that exist in veterinary medicine.
Yeah, absolutely. I mean, I think that working on the access to care issue, definitely opens up a lot of opportunities for us in the profession, serving more clients, keeping clients and pets together. We know that pets are part of the bonded family. They are family members for a lot of people. And so, coming to a clinic and being told, your pet's sick, you need to the gold standard is to, hospitalize them for days and pay, several $1,000s, and that's not feasible for a lot of people. And I think one of the key things about the spectrum of care is that when we're communicating with clients around it, we have to go back, we have to be empathetic. And we have to make sure that they know, and we have to have the mindset of the choice that they make is not a reflection of how much they love their pet. And so it's something that, that's, kind of one of, for me, the key components. One of my cats is going through chemotherapy right now. And when we diagnosed him, we talked to the oncologist about all the different options, and we didn't pick the gold standard, most aggressive chemotherapy option for him because the specialty hospital is an hour away from us and he gets super stressed in the car. And to me, it wasn't fair to be dragging him to the specialty hospital once a week for chemotherapy treatment. So we went with a less invasive, or I guess less intense protocol for him, where we only had to go every 3 weeks. And for me, that's another example of spectrum of care. We took into account, our own schedules and his stress level to make that decision.
Kate, I'm going to connect this episode with an episode of our webinar that we did a talk to recently. I had Ivan's VP of telehealth, Sarah, on our webinar series, and we talked about the role that telehealth has in the spectrum of care. And so with someone kind of deep in the middle of all of these different organizations and with a fascination on spectrum of care, what do you think telehealth's role is in spectrum of care?
Yeah, I think, I definitely think there's a place for it. I think a lot of times when we're working in the spectrum of care, we may employ kind of an incremental approach where we say, okay, they come in, we try some symptomatic treatment, but if this doesn't work, this is the next step. And I think telehealth could be a really good option for some of those follow-up visits, especially for someone who might maybe their limitation is their schedule or their ability to travel to the clinic. Telehealth definitely would allow more communication with the client and at least getting a visual on the pet, in addition to, if you're doing the video visits, in addition to just a client calling with an update. So I think for some things, I definitely think that it can play a role in that follow-up area.
So what do we need to teach our students? What are you talking to? I know that you just lectured in Cornell yesterday, and if it was on spectrum of care, I didn't ask that. But if it was, what is the message that you're trying to relay to our new graduates, and what are you teaching them to be aware of going out there?
Yeah, so I think the big thing I'm teaching them to be aware of is just that, this is a way to practice. This is something that people have been doing for a long time, but it's kind of as we've had more innovation and more, technological advances and medical advances, we still only go to school for 4 years. There's only so much we can learn in that time, and we know there's a huge learning curve after practice. But it's just making them aware that, it's okay to not always practice gold standard medicine, and that, presenting along this spectrum is the way that we're gonna help the most pets and patients. It's the way that we're gonna, feel good about ourselves for being able to help them. And I think there's some really cool things happening in the educational space. Some of the schools have really embraced the concept. Ohio State now has a spectrum of care clinic. There was, I think it was a 2021 JAVMA article about their educational model. And so I think it is coming to the schools. And, I mean, I love lecturing, and I love giving that spectrum of care lecture in particular. But, maybe down the road, I don't have to go and give that particular lecture because it's already embedded in the curriculum.
Yeah, it seems like that has to happen, because these are tools that I think not just the new grads, but every veterinarian needs to kind of know what facilities are available to them. Another one of the fascinating episodes that we did recently was on teleconsultation with specialties. And the example that was given was one of a pet parent needing to go see an oncologist that was 3.5 hours away, but then the local veterinarian connected with the oncologist and was able to kind of, through a teleconsultation, kind of increase, I think, the spectrum of care. What do you think about that area of veterinary medicine?
Yeah, I absolutely think that, the teleconsultations, collaborating and communicating with specialists, as a generalist, there are things that I don't know, and I know I don't know them. And so I'm often reaching out to my colleagues, and I think having that, that additional level of connection, with a formal teleconsultation model can really open up some doors to people who couldn't go to specialty care before. In my area, it's a good hour plus to any specialist. So, being able to say, hey, you don't have to travel. Let's do a teleconsult with them, and working that into our model of practice, I think can definitely open up more options for our clients.
I love how you mentioned the general practitioner, and we don't know everything. And I was just reflecting on my emergency years, and it's like, yeah, we don't know everything, but I will try these things because we're in an emergency situation. But I love that application of teleconsulting, which is actually that's the specific niche. It's consulting the specialist to a veterinarian, and which doesn't have the international or state borders, which is phenomenal
Mhm.
because that's not a telehealth that is bound by VCPR. But I wanted to kind of maybe get a kind of a practical examples of how can we overcome barriers to spectrum of care. What are those practical tips? 3 or 5 ways to overcome barriers to spectrum of care from Dr. Kate Boatright, if you were publish something like that.
Yeah, so I mean, I think first we have to identify those barriers. One of the biggest ones is the fear. I think especially for new grads who don't have the experience, or exposure to practicing this way, there's a big fear of client complaints or even worse, board action, legal liability. What are we opening ourselves up to by not employing that, gold standard method that we were taught? And for me, I think the biggest way to overcome that is, one, making sure we're protecting ourselves. We're having really good documentation of all of our client communication. And essentially, we're still offering all of the options to the clients. We're laying out, here's your range of options, and we're going to work together. We're going to make a team to select the best option for the limitations that you have. So it's not that we're picking the option for the client. I think that's really important. We're presenting the range of options. We're employing that relationship-centered communication model, and just working with them and then documenting everything. Hey, I offered referral to a specialist, they declined. I offered this test, they declined. And in my records, I'll usually put, owner was unable to travel, or I'll put a little more context to it. And then so we elected to do XYZ. I recently had a case of, it was a DKA that presented in my GP clinic, and I worked emergency for years, so I'm pretty comfortable, as comfortable as you can be treating a DKA. And I said, look, like, your dog really needs to go for 24-hour care. And he couldn't do that. His wife at home had some medical issues, and he couldn't be away from her that long to take the dog to specialty care. And so we figured out a way to treat her in our hospital. And we said, this is not the ideal. This may not have a great outcome, but we're willing to try. And so we treated her as an inpatient during the day, and she would go home at night with a long-acting insulin. And 2 days later, she was out of DKA. We just saw her for a recheck recently. She's been a diabetic for 6 or 8 months and is well controlled now. So I think it's having that confidence to offer the options, and knowing that, doing some treatment is in many cases better than none.
Kate, it's so fascinating, as a non-veterinarian. I have to say that over and over again because the number of times that I get referred to as Dr. Wilkie is ridiculous. So I'm not a veterinarian, but I love having these conversations with professionals in the industry. So this idea or topic of spectrum of care is an ever-expanding one because of all of the innovation that's finally happening in veterinary medicine. There's companies doing things with AI. There's companies doing things with augmented reality. Me and Ivan have such a luxury because we get to have so many conversations with so many different people, kind of really trying to help fix or change or solve some of the issues in veterinary medicine. Being in this world, kind of pursuing spectrum of care and your other initiatives full time, but also, having positions in the AVMA. What do you think of all of the innovation that's happening in veterinary medicine, and what should practicing veterinarians think of it, and where should they maybe focus some of their time, effort, and energy if they're trying to kind of solve some of the issues that are plaguing them as a practicing veterinarian?
Well, that's a big question.
That's what we do here.
Yeah, we need to be asking the big questions. I mean, I'm excited by a lot of the changes and innovation that are happening, the shifts in conversation. I think that these are things that need to happen. I think as much as COVID was a pain in the ass for most of us, it really catalyzed a lot of shifts in our practice models, in how we approach care, in telehealth. So I think we needed something to break the norm, so that we could have the ability to innovate. And I think specific to spectrum of care, one of the big places that we need more work, and there are the ASPCA is doing a lot of work. Nationwide Pet Insurance does a lot with spectrum of care now, but there is the research, is having the data to support these alternative options. There was a whole series of papers that came out from the ASPCA on managing pyometras, PU surgeries, in cats, and outcomes in a general practice setting. And I think we need more of that. We need more of the research to support what we're doing, because that's also going to help us overcome that barrier of the comfort level and the concern of being judged by our colleagues, when we're practicing in a different range on the spectrum. But yeah, ultimately, I think that these are good things. They can be uncomfortable conversations sometimes, but we need to have them.
Awesome. Well, amen to that. And we're out of time as usually. So we usually ask two questions at the end of the show. The first one is there a book, TED Talk, video, movie, anything that inspired you recently that you would recommend to our listeners?
Yeah, so for me, I really love Brené Brown. And I keep going back to a lot of her books. I've recently started revisiting The Gifts of Imperfection, which has been, a really great reminder that, we don't need to be perfect to still succeed in this world.
That's awesome. And the last question is another innovator that you think we should have on the show.
Yeah, so as I started to think about that question, I was looking back at your past guests, and like most of my friends who I think of as innovators have already been on this. But I really a couple of vets that I've connected with in the Instagram community. Dr. Mariah McCauley is doing a lot with mentorship, and Dr. Danielle Alleman does a lot with veterinary wellness. So both of them are doing fantastic things.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.to. See you next week.